Again, welcome everyone to the Voucher Learning Collaborative. I am delighted to see so many of you here today. For those of you who may be new, this learning collaborative we're really committed to providing a space for you for peer learning, for networking, specifically around Respite Voucher program implementation. And that's, whether you're a novice or you're an experienced voucher administrator, or if you're just exploring the possibilities, we welcome you to the group and we're happy to have you. I'm Jill Kagan with the ARCH National Respite Network and Resource Center. And I want to take a moment just to introduce you to our learning collaborative leaders. And in the meantime, please feel free to say hello in the chat. You'll all have an opportunity. We're going to be doing breakout sessions today, so you'll have an opportunity to introduce yourselves in small groups at that time. But say hi in the chat so we know you're here. First, I'd like to introduce our team from Oklahoma, starting with Nadine Walter.
Hello, everybody. I'm Nadine Walter. I work for the Oklahoma Human Services, and in the Oklahoma Human Services, there is a division known as the Community Living and Aging and Protective Services. And we have a great team. We're the Lifespan Respite Grant and have a great team. 2 members are on, Aida and Selena. Aida, you want to introduce yourself?
Yes. Hi, everyone. Aida Stevens. I'm the Executive Director for Sooner Success. Have had the privilege to work with Nadine and Jill over the years and look forward to today's meeting.
Hello, everyone. I'm Talina Ford, and I'm the program supervisor under Nadine, and I'm the newest to the team and excited to be here and learn.
Welcome, Talina. And Tracy from Washington.
Hi, all. I'm the Executive Director of PEEV, which is contracted by our fabulous partners, ALSA, from which I have our fabulous Roz with us, and I'll let her introduce from the state of Washington.
Hi, all. I'm Rosalind Albert. I'm the Kinship and Lifespan Respite Program Manager at ALSA. I'm working with Tracy, and we're just excited to be here and learn more and connect. Thanks.
Thank you all. We're just so fortunate on this particular learning collaborative that we have had experienced voucher program folks step forward to help lead the collaborative so that it's really a meeting of colleagues sharing their knowledge and their experience. So thank you again to our leadership of the collaborative. I'm going to go ahead and just share my screen for 1 minute. Are you able to see the slides?
Yes.
Okay, great. I just have a few little things to discuss. I did mention that you will have a chance to introduce yourselves in more detail in a minute. I just wanted to share with you the agenda. The Learning Collaborative leaders met a while back to plan today's agenda, and they really recommended that we use the small group discussion format to do some deeper diving into a few of the issues that you all have previously identified as priorities. And so we're going to try this format for most of the meeting today, and I hope that it's useful to all of you. As you can see from the agenda, we've identified 3 topics for breakout group discussions. Each session will be about 20 minutes, and we'll then repeat those same 3 topics and come back together in a large group at the end to share any highlights or respond to any questions, and hopefully have a little bit of time to identify topics that might have emerged for future meetings. I wanted to provide a little bit of context for why we chose these particular topics. On the last few calls, we collected information from all of you through polling and discussion about the issues you wanted to focus on in the Learning Collaborative. And as you can see from the results, the top 2 broad issues that emerged were type of voucher program and administrative issues. Each one having almost twice as many respondents identify them as priority areas compared to the other also very important issues on the list, which at some point I'm sure we'll be getting to as well. but we thought we would start here. When we dove a little more into discussion among the leadership, we agreed that discussion would be more meaningful if we narrowed these gigantic fields of interest just a little bit and pulled out a few discrete topics that fall under or into these broader categories. And so the first topic is flexible and responsive voucher programs. And we're hoping this discussion will focus on some of the distinct features of your respite voucher programs that make them particularly responsive to the needs of family caregivers, but still maintain and ensure quality of care. And some of those issues might involve self-direction, for example, and possibly the most successful strategy for providing respite vouchers that offers the greatest flexibility is through self-direction, where families select their own respite provider or program, but there are different ways of doing this. And we've structured some of the questions so we can identify what the differences are and discuss the pros and cons of each. Under this topic, you could also talk about voucher reimbursement. There are different ways that vouchers can work, either by reimbursing the family caregiver or reimbursing the respite provider, or both, and the pros and cons of each. And then just to brainstorm a little bit more about what other aspects of your respite program really ensure flexibility so that they're most useful to family caregivers. And that group is going to be facilitated by Tracy Kahlo from Lifespan Respite Washington. The second group, voucher program outreach. I know a lot of you, or most of you, do target hard to reach or unserved populations with your respite vouchers. So we want to explore how you made the decisions to target which groups. Maybe it's grandparents raising grandchildren, or different cultural groups, or people on Medicaid waiting lists. To talk about how you and why you identified those groups, and then to really delve into what outreach strategies or approaches do you use to reach the populations that you're targeting. And this group will be facilitated by Aida Stevens and Nadine Walter from Oklahoma. And then the third group, helping family caregivers navigate and access respite. This session was kind of my idea. And it's intended to learn a little bit more about how and to what extent, as a voucher program, you use staff to work one-on-one with family caregivers, to help them understand the voucher program, to help them find and use respite providers, and maybe even help them plan for their respite time. And if you do this, we'd like to know if you're using any tools to help you do it. If you're using staff, how much staff time is needed, and what are the costs you incur for providing this level of assistance to family caregivers? And do any of your staff require training that might help them provide this guidance to family caregivers? So those are just some of the topics that we hope to explore in the third group. Now, for the way it's going to, well, first, before I move on, does anyone have any questions about those particular topics or clarification on them? Feel free to unmute yourselves or put it in the chat. No questions? Do my leaders have anything to add to that? Okay. So in terms of instructions, I mentioned that each group will have a facilitator and who they are. Once I open up the breakout rooms, they'll be labeled with the title of the group, and you'll have the option to select which group you want to join. Just click on join when prompted, and we hope it works, because if you can't get in, I'm not sure I know how to help you do that. That's where we might run into a technology problem, but I hope you'll all be able to join easily. We do encourage you to turn on your camera once you're in the breakout room, if you have the bandwidth, because I think it really helps us engage with each other when we can see your face. We will be referring to the discussion guide that I sent out previously. If you didn't get it, I'm putting a copy of it in the chat right now. There's also a link to it on this slide. But I hope that you'll have that in front of you if possible. Your facilitators will have a copy of it as well. Don't worry about getting through all the questions. There are a lot of questions in the group. We gave you a lot of questions to help you stimulate a free flow of ideas while helping you all stay on topic. But progress at your own pace. 20 minutes is not a lot of time, but it'll give us an idea of where interest and expertise is. As I mentioned, each session will be 20 minutes, and then you'll be automatically returned to the main room. We'll take a couple of minutes to relaunch those breakout rooms, and you should feel free to return to the same group you were in if you were really getting into the topic, or feel free to switch to another topic and another group. And we'll do that again for 20 minutes. Our facilitators will be attempting to record the session so that those who are not with us today will be able to listen later. Again, at the conclusion of the second breakout, it'll automatically send you back to the main room. And then if we have about 20 minutes or a half an hour left at the end, we'll be able to discuss any highlights that anybody wants to share from any of the three groups, any action steps that came out of those discussions. And then again, any ideas for future meetings. Hopefully these discussions will generate some areas we really want to do more in-depth look, or generate some new ideas completely. So does anybody have any questions about that? About the instructions? Okay. So now we can see each other. All right, I'm going to then go ahead and launch the breakout rooms. As soon as you get the invitation to join, pick the group that you'd like to be in. And we'll see you on the other side. A minute or so. Well, I won't take too much offense that only one person came to my group, but I hope you all had really wonderful discussions in the other two groups. And I was fortunate to get to reconnect with an old colleague from Delaware on our one-on-one. So that was wonderful. Why don't we take a few minutes for if anyone has any highlights from their group that you want to share. And then maybe we can talk about some unanswered questions. Anybody from group one with Tracy? Did you have any highlights that you wanted to share from your group?
Well, I'll just share my notes and then the crew can say anything that they want if you'd like. But in essence, we had a robust conversation on supporting each other around self-directed care and affirming that the care recipient is getting the respite that they are seeking. So I'll just share this bit and I'll let Amy share her willingness to be seeking what she's seeking if she likes to, or any other group that was a part of that. So I'm sharing my notes, maybe not yet. Can you see it or not?
Yeah, we see them.
Okay, I'm so used to Teams doing my square and there was no square, so I couldn't see it. So in essence, we were really in this direct self-directed, and that Colorado is hosting a panel is where I'll end it and I will stop speaking.
Yeah, I was just to follow up on that. I was just saying that, you know, Colorado is planning on doing a panel on self-directed support. And one thing we were hoping to do is get different state or different program perspectives on that panel. It's for Colorado specifically, but I wasn't sure what maybe information sharing we could do among this group with contact information. And then there was other information that others were interested in sharing too. For example, hold harmless statements that you might have the caregiver sign that if they are using a family member or friend or something like that for respite, that they would sign a hold harmless statement. And then that would absolve the agency of, indemnify the agency, as well as perhaps eliminate the need to do background checks. So kind of a couple of things: contact info sharing, resource sharing. Who wants to be on my panel?
Can you give us a little more information? What is the panel for?
Oh, sure. So Colorado has an organization called the Colorado Respite Coalition. Megan Bettinger and Aaron Myrant, who are on this call, are the Colorado Respite Coalition, essentially. And we hold these meetings with providers and the area agencies on aging and anyone who's kind of involved in respite. And what we'd like to do is have a panel discussion during one of those meetings, specifically on the use of self-directed vouchers for respite care. And the reason we're interested in that is because in Colorado, we do it, some agencies do it, some don't, some only go with providers. But what we're finding is that providers are just simply not available, especially in the more rural areas of the state. And so we're hoping to do kind of a conversation, education to see if that might be a road that some agencies want to walk down to be better able to provide respite care, especially in those rural areas.
Well, there are lots of folks on the call today who represent lifespan states that do have completely self-directed programs. So if anybody wants to put your name, give your contact information to Amy, I'm sure she would greatly appreciate that. As far as Hold Harmless and other kinds of voucher tools, you can find them on the ARCH website. I know there's some Hold Harmless tools up there. I'll do a little bit of research and put the link to that in the chat for you too, so you can all access those respite voucher tools that states have shared. Since 2009, we've been collecting a lot of state tools, and we try to, when states are willing to share them, we put them on the ARCH website. Anybody else from that group have anything they wanted to share?
I do.
Okay.
Just on an outcome, the percentage of renewals was something that was discussed, and I thought, oh, that's a really good outcome to look at, is percentage of renewals. So I just have a note. I don't know if that means much to anybody, but I'm a data person, so I'd like to know that type of information. So I just wanted to shout that out.
Just for clarification, by renewals, you mean families who come to you a second or a third time for additional vouchers?
Yes, voucher renewal.
Okay. Anybody here want to take a stab at that? Any initial thoughts?
I'm just excited that Lynn is a data because
Yeah, we're excited
God
about
knows
that
we love that. And it's kind of fascinating and sharing with each other how that, comes along, right? Because there's need that is so great. And then how do you continue to serve as many as you possibly can? So we did have a chat about first come, first serve and how that's being tracked, but I agree.
Any other points from group one? Anything you learned that you didn't know before? Those of you who are in either of the group ones?
Jill, this is Lita. I think just the knowledge that, some areas are able to directly reimburse the caregiver. To me, that's a dream, because working for the state, that's a little bit harder to set up. But I want to explore that a little bit more rather than, jumping through some of those hoops with the caregivers and the reimbursement models. So that was really helpful.
Yeah, that is wonderful. We have heard that too, that it's a big barrier for family caregivers to have to wait to be reimbursed for the care that they seek. And if you're able to offer the funding up front, it certainly can be helpful. Any other questions or comments about group one? Group two on outreach. Aida or Nadine, do you have any highlights you want to kick the group off with?
I can talk just real quickly about the main ones that we talked about that we all seem to be kind of in agreement that we outreach pretty heavily, is the Hispanic population, tribal population, the kinship navigator programs. Those were kind of commonalities between most of us. We kind of got off onto providing those that have children with mental health issues. And we really kind of dived into that at the end, because that's, I think maybe a lot of us are helping and we don't know we're helping the children with mental health issues. but I thought that was a good one. Aida, was there anything else in your notes that?
Yeah, just two more, the Marshallese as well as those that live in a rural community. Yeah, again, due to the limited number perhaps of respite options, just helping those family caregivers think creatively. And again, going back to individuals that have high needs, whether that's mental health or even medical needs, and just thinking of who may already be in good position that's offering a service, whether that's through school, a para professional, and then perhaps since they know the individual, seeing if it's possible for them to provide a couple of hours of respite. So I agree. And Jill, you know how these are. You think you have plenty of time, but you start learning from each other. It's just so helpful to hear. But no, Nadine, I think that was the main ones, and really just meeting families where they are, having cultural sensitivity, competency, having really just a commitment to listen and try to help provide respite and other resources to those family caregivers.
Being intentional to add to your website Spanish or the flyers or brochures, or just being very intentional on those populations we're trying to reach, I think is important. I think we all mean well, but we've got to really be able to show it too. So anything else, group two? I don't think anybody left after the first one. They all stayed in. We kept learning from each other, which was awesome. And then we had some extras. Anybody else in group two that we missed?
Any other fantastic outreach strategies that were shared? Because we're always looking for new messaging or new tools or new ways of reaching. Once we identify these families, it's easy to identify lots of unserved groups of families, but how do we reach them?
Patrick, do you want to talk about what you might be trying?
A little bit. So it's still a ways away, but we're looking at launching some online communities for those that are providers or for those caregivers. Just essentially a place where they can go communicate. There can be bring some guest speakers in or do some trainings for them. Eventually do some little contests or have some little courses they could go through, but somehow keeping them involved and expand that community.
So a joint group, providers and caregivers, family caregivers?
No, we'll be looking at two different ones.
Okay.
But just essentially the platform we're looking at has the different options for them, for us to hold two different communities or more. But then you can communicate with them on a different level and almost instant message, or you can do emails, just find what works for them. In a sort of a confined space. It wouldn't be like open out to the public.
That's very interesting. That would really give some personal attention to those caregivers and also those providers for recruiting providers for special needs groups.
Yep. So, and it's really important. You have to have a moderator, someone who's watching that, leading the discussion. Really, that's really the key. So once that's in place, then we can start to build it out.
So that requires some staff resources and time.
And our grant that we just built some into that.
Awesome. That's cool.
Sarah
Anybody
has
else?
her hand up, Jill.
Go ahead.
So I didn't mention this in our other one, just because it's so new to us. We just finished a very preliminary caregiver data survey that had a small targeted population. But one of the things we found interesting is we asked the question of where do they look for information and resources, and the majority of these had never even heard of respite before. But the top answer, I mean, I would say roughly 70% of them said through their doctor or their healthcare professional. So part of what we've been trying to brainstorm is how do we get our information out into these doctors' offices? So I don't know if anybody has ever done any of that kind of thing, getting it out into the medical offices. But that's something we thought might be beneficial because, especially in our rural area, that's pretty much where they've said they're getting the bulk of their information, other than from family and friends, and of course, online and social media.
Is anyone from South Carolina on the line? Because I think they did develop some outreach tools specifically for the medical profession, or they were working on them. I'm not sure they've been completed yet. I don't think that we have anyone from South Carolina today. I'll follow up with South
Jill?
Carolina and see if we can find some tools.
Jill, this is Marilyn from Idaho. We have that Family Caregiver Navigator demonstration project. And one of the things that we used as outreach to the medical community for that was an RX pad. We shared it with New York, where the provider, the medical provider, PCP, whomever can just write the caregiver's name in, and it gives them, and tear it off and hand it to them, and it gives them the access to the navigator information.
Oh, that's cool. Did a lot of your medical providers use it?
Some, not like we'd like, but we were doing this in the middle of the pandemic. Too.
Yeah.
So,
that's a cool idea. Yeah.
Jill,
Yes.
it helps because we're here at the University of Oklahoma Health Sciences Center. So we do a rotation for residents that are, pursuing the medical field. And we also physically go to clinics, to really providers across the state, take them handouts. And now that individuals are feeling safer to have in person, we also do have, community events that are starting to resume. We have active coalitions across the state where we do intentionally try to reach the medical providers, because yes, I think that is a great partner that they are hopefully seeing those medical professionals. And so the more they know about respite that we're offering, they're going to give that information to family caregivers, or even directly refer. Again, because we're under the same umbrella for many of them, they can do a direct referral. But I have also seen it work for external partners in terms of establishing like a data share agreement. But anyways, it is very helpful. So please, yes, make sure your medical partners know that you have respite vouchers, because they're good at getting it, even if it's just in their clinic waiting room, right? That's just another way to get the information out. And I love that angle.
Yeah, that's one of the things, I mean, that was our first thought, was we're just going to go doctor's office to say, can we drop off these brochures and you put them in your office? I mean, that's the first thing we thought to do, but how could we expand it? So this is great. Thanks.
Some states that also have implemented the CARE Act, the legislation that was promoted by AARP to require hospitals to identify a family caregiver in the transition from hospital to home, and provide any supports and training that the caregiver would need. I believe New York has developed a package of information around caregiver supports that they developed specifically to give to hospitals to work with family caregivers who are helping their loved one transition from hospital to home. That probably has some useful information there too that can be used by people in the medical profession to share with caregivers. I'll see if I can get a copy. If we don't have that up on the website already, I'll see if I can get that information to share with all of you too. Anything else from that group? You guys did a lot of great work in that group too. Wonderful. Our final group on group 3 around providing and more intensive and deliberate support to family caregivers to help them understand voucher programs, to help them find respite providers. We had some interesting discussion too, and I learned something that I didn't know before. I know Lynn has stepped away, but well, there she is. In Idaho, they actually will do, and I guess most of this is through their Title III program, a home visit with a family caregiver if their level of need for understanding how to access respite is great. A home visitor will actually go into the home and do an assessment and help the family caregiver navigate that service. And that's the most intensive support I've heard about in terms of helping navigate the voucher system. So I'm wondering, does anybody else, any other states do something similar?
This is Cheryl. I didn't participate in group 3. I'm sorry, I couldn't get to all of the groups, right? So you have to pick and choose, but
yeah,
we're anticipating some challenges with refugee populations and figuring out what that is going to look like culturally. And we're all, you know, strangers. We're not part of that culture. We're not somebody. So partnering with some international alliances or and those that can have that trust established, and then trying to build respite in that community when they're brand new, no one's speaking, you know, you got to language barriers and stuff like that. I think that's going to be a unique challenge to helping families navigate respite options, and any other assistance that they're looking for is going to be some of those cultural language barriers where we're not used to working with our Hispanic or our Native American or other populations that we've already got some relationships with. They're new. So Ukrainian refugees in particular. So something to think about. I don't have any answers for.
No, that's an excellent point. Absolutely. We should be thinking more about that. On the home visiting front, is there anyone else who's utilizing that as a navigation tool? I mean, that requires pretty intensive dedication of resources, staff, money. But I was thrilled to hear that they were doing that in Idaho, especially in a rural, isolated areas. That's a great way to make sure you're connecting with those more isolated caregivers.
So I have a question. Lynn, is that the Title III Older Americans Act program staff that are going out and doing that, or is that Lifespan Respite Grant staff?
It's both.
Yeah.
And lifespan respite for grandparents and raising grandchildren and relatives raising grandchildren, and our Title III for the older Americans.
Okay.
Yeah, we have some very dedicated social workers in some of our areas, I'll tell you that.
Yeah. I know our Title III in Oklahoma, they all go out and do an assessment, and respite is a part of that. So the Older Americans Act carries the big brunt of that, but that's for the grandparents raising grandchildren over 55, and then the, you know, the older population 60 plus that are doing that. And then AIDA's crew takes care of a lot of the others, but yeah, it takes a big team to do that.
It's funny though, it did raise the question that I'm going to ask them, you know, what is the ratio between a home visit and a telephone consultation? So I'm going to ask them that today, actually.
Yeah, that's interesting.
Yeah, the level of support that a family caregiver might need is going to differ drastically. And how do you make those decisions? How do you figure out how much help they need just to access the service?
Yeah.
Another big question that, oh, go ahead, I'm sorry.
No, as I say, I know our Title III, when they go out, the Older Americans Act, when they go out, they're not just assessing the needs for respite,
Right.
they're doing home delivered meals and all the above. Right. So it's more of a comprehensive assessment. It's just not that one service. So they get a bigger bang for the buck, I guess you'd say. I don't know, but it's much needed and much appreciated by those caregivers for sure.
I mean, if other states' Title III programs are doing these home visits and not letting people know about lifespan respite voucher programs, you should make sure that they are doing that. If
I think
that's an
that goes-
avenue.
I think that goes back to your coalitions talking and your various respite programs talking and coordinating those, you know, knowing what each other does. for
Right,
Sure.
exactly. Well, one big question that came up twice in my group, and we didn't get, it was at the end of both sessions, so we didn't get any answers, but I know we've discussed this before, but what do you all do when you're giving out your vouchers to families, but they're not using them? How do you encourage greater use and make sure those dollars are getting spent? Did I
Well,
phrase that
Jill-
correctly for those of you who had that question?
Jill, we try to just have a conversation with them, you know, just really try to brainstorm alongside with them. We've also had good success with looking at therapeutic writing programs, art programs, where individuals can participate in that activity and the provider will accept a voucher. Because again, even if that's 1 hour, that's 1 hour of respite for the family caregiver. So just really trying to help them think outside of maybe what they've already tried. Camp obviously is always a great one. And we have had good success with our camp partners across the state that will accept our lifespan respite voucher. So just some ideas to throw out there.
And we're fortunate with the lifespan respite dollars that there is that amount of flexibility. Right now, especially as a result of the pandemic, that ACL has been very generous in saying, you know, whatever is going to get the family some respite, we're going to be a lot more lenient in how you spend those vouchers. But I know other programs like the Title III may have stronger restrictions on how it has to be more of the traditional model of respite care that can be reimbursed. But I'm wondering for the rest of you, I know this has come up so many times with many of our voucher programs, that it gets to be toward the end of the quarter and they see the dollars aren't getting spent, even though they've been awarded. Are you doing some similar things that Aida was talking about, just working with those families and making sure they can use those voucher dollars for the things that will really be meaningful for them? Or how do you deal with that?
Jill, this is Cheryl from Nevada. I just want to remind everyone that self-directed does not mean that we leave caregivers without support and that they've got to figure out everything. I'm so frustrated when our voucher programs give a list of 100 potential providers for them to call in their spare time, which they have none of, to find out that none of them meet their needs or have providers. So that whole sense of self-directed, there was a real evidence in our pilot to have supports in place to walk them, guide them, hold their hand, and do some case management along with the idea of the voucher. So just want to point that out, that it usually requires a little bit more assistance than we think a self-directed model might need.
Yeah, we spent a lot of time in group 3 talking about that. That was kind of the point of group 3. What does self-directed really mean? You throw them out there on their own with the dollars, or how much assistance do we provide to make sure they're actually accessing services?
Bill, ours is pretty self-directed too. What we've done is we've brought the voucher program in-house here at DHS, but we've connected it to our ADRC, our resource center here in our division, so that not only are they helping them with the respite vouchers and everything else, but they are the group here that knows about all the other options, all the other supports out there that a caregiver could maybe tap into, programs that may be available that they didn't know. So we've kind of added that extra layer that they have our resource center specialists that can kind of help guide them in other areas as well.
Great. Any other thoughts on that topic? Well, we only have 3 more minutes left, and I'm wondering in this last few minutes, if any of you want to, was there something in particular that we only barely touched on that you would like us to delve more deeply into in this collaborative so that we could focus our next meeting on that topic or 1 or 2 topics?
I kind of like the conversation you were having about the unused. Oh, yeah, I would like, that's a really, I'd like to take a deeper dive into that. You know, what do you do if they decide they're not going to spend their voucher? Then you got to recoup then you got to reallocate. You know, what's a good, effective, efficient process for that?
Yeah, that's come up more than once.
Yeah,
and I know that
unspent.
there are some of our grantees who have come up with some great strategies for that. So I hope they'll be willing to share, and maybe we can identify who they are and they'd be willing to speak at the next meeting.
Jill, this is Cheryl in Nevada again. It may be related somewhat to the length of the voucher time frame.
Yes.
The shorter ones versus longer ones. And so just to point out some of the differences and the challenges of each and how you would handle that.
Yeah, I think a lot of our lifespan programs started out allowing a year for the caregiver to use the vouchers, and that really provided a lot of administrative nightmares around not spending the dollars in a timely way. And I think that's why a lot of the voucher programs went to quarterly issuing of vouchers, so that the family caregiver would have 3 months in which to spend those funds rather than 12 months.
And Jill, just another angle, informing potential respite providers in your areas, making sure they're aware of the program. They're in good position to share it with families oftentimes. So I think, again, the better informed they also are, that again, they may not fit in what we would know as a respite provider box per se, but they're in good position to offer respite. So I would say also, if you think of who that might be, making sure they have, oh, there's my timer, making sure they have the information that you're going to potentially reach new family caregivers too, right? Because they are working with those families. So I love that angle too, just throwing it out there.
No, that's great. That's a very good point.
And this is Sue. I know we're at time, but I did want to continue that navigation discussion. I'm sorry to have abandoned you on the work group, but I was looking to participate elsewhere. But here in Wisconsin, while we found that the ADRCs are a good source for the adults, they are not serving our children populations, and it is a very complicated maze for families to navigate through the system, with their children on top of all of the other connections that they need to make with schools and doctors. And, we know it's a very complicated system. And so we have just been funded for through ARPA with a no wrong door approach. And so for our department. And so I'm continued to be interested in that topic.
On the children's side, do you work closely also with your family to family health information center?
Yes, we do, right. And, as well as our public health, children with youth, special health care needs, there's, a variety of different partners, and then making sure that, again, our Respite Care of Wisconsin organization is helping our families to navigate through all of those various doors. Yep.
Any other last minute thoughts? I do want to be respectful of your time, and we have 2 minutes after 3. So I think we will close out, and I want to say thank you again to our collaborative leaders for facilitating these sessions. And if you all want to give me a thumbs up or a thumbs down if you like the format for today, we can do this again sometime, having the small group discuss. Oh, look at all the thumbs up. I think we found a new format for our voucher collaborative. And from time to time, we can bring in some experts to help us as well. But I think we have enough expertise right here within our own group that we can keep turning to each other for this wonderful information. So thank you again for being part of the group. Thank you for participating in the small groups. Thank you to our Learning Collaborative leaders. And we'll see you at our next meeting in about 3 months. And feel free to email at any time if you have questions in between. Thank you all. Bye-bye, everybody.